Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Samantha Scott. This is your second time on Focus on Health, and you are a psychologist, and you're also the clinical director of the Child and Family Center located here in Salisbury, Maryland.
Yes, ma'am.
And you wanted to come in and talk about a very important topic related to COVID. We've done a lot of shows on COVID of late, especially about the physical aspects more so, but you are here to talk about the mental health impact.
Yes.
So talk to us about that. What exactly is going on? It's been several months now we've been dealing with all these stressors.
Right. Well, I think it's important that people understand why mental health has taken such a toll during this pandemic. And the best way that I can explain it is to really think back to March when this happened. We found out about this pandemic, and I think early on, without knowing a whole lot of information, a lot of people hit a fight or flight phenomenon. And everyone's probably learned about that in, ninth grade biology. But it's a very natural response to when your well-being is threatened. And for a lot of people, this was fine. We all kind of hit the ground running. You saw parents setting up workstations for their kids so they could do virtual schooling, and people were baking bread and eating dinner together and cleaning out the garage. And, so this was we're going to tackle this, we can do this response to this threat to us. What I started seeing about 4 to 6 weeks after, all of this started, was people started hitting a wall. And I think when it hit, we all were kind of under the impression that this was going to be about a month and we were going to get through this and then move on. And then as time went by and things weren't changing and they were actually getting worse and a little scarier, this is when we started seeing a lot more people coming to us for help and really starting to get overwhelmed. And really what happens is our bodies are not set up to be in that heightened state of arousal for a long time. And for a lot of people, it was just getting worse. And so I think what started happening early on is because we kept going through this stressor, you started seeing decreases in executive functioning and just being able to handle typical daily activities. And we talk a lot about increased cognitive load. And the best way I can describe it is if you think about your computer desktop, and if you have multiple files open, what happens? You start to get confused. Your computer runs slower. It might eventually just shut down because it is overloaded. And it's the best way I can explain what happened to a lot of us, including our kids and teenagers. And early on, everyone's schedules were thrown off. We were stuck at home. We were missing out on a lot of the outlets that would prevent some of this stress from getting to us. And so over time, I think this is a good way to explain some of the mental health issues that have evolved. So when you think about executive functioning, and this pertains to people who are working as well as our kids and teenagers trying to handle school at home, I'm talking about just working memory, planning and organizing, multitasking. And so when you think about a child who's used to going to school and having teachers all day tell them what to do and how to do it, and now you're putting them behind a screen and expecting them to know what to do, how to get started on something, and to do that independently, it just wasn't working. And so the next kind of cascade of problems that I saw early on was lots of problems within the family system. So parents who aren't teachers have no idea how to support their child. Kids are frustrated, parents are frustrated. They're not getting any kind of outlet socially, and there's all this anxiety about what's next because we just didn't know. So in terms of mental health issues that have evolved, certainly anxiety and depression. And I think over time, parents, I saw a lot of arguing and fighting within the family system. There was a lot more screen time and just alone time because people could not get along or didn't know how to talk to one another about how they were feeling and what was going on. So certainly, I'm seeing a lot more depression, a lot more isolation, trouble with school and multitasking and handling all of the demands of life in general, and then a lot of family discord.
I know the way I looked at it early on, my assessment of it was one of the worst things is uncertainty. And early on, that was huge. People just had a hard time coping because you just didn't know when it was going to end. And now we're starting to see a little bit of light at the end of the tunnel, but now they're talking about COVID fatigue. And that's a very real thing.
It absolutely is. And I think it goes hand in hand with the mental health issues that we're seeing. And so it's this awful negative cycle. So we're not functioning at capacity. And I had a lot of people early on say, I just don't understand why I have no energy. I'm home all day. I don't have as many things to do, but I can't get anything done. I can't concentrate. I'm less productive at work. My kids are less productive in school. And it's exactly what you're talking about, this COVID fatigue or this cognitive load. We're just depleted. And then you start seeing people feel very bad about that. So you see the anxiety and guilt from not being able to complete things that you should. And we hear a lot of shoulds. I should be able to do this. My kids should be able to write an essay. But we're not emotionally prepared to handle the stress that we're under and function like we typically do when we're not under that type of stress.
So it sounds like a horrible, vicious cycle.
I know, it has been for a lot of people. Early on, especially in the spring, a lot of my advice was do what you can. It's just not worth the daily battles and tears and emotional discord within a family. And then we kind of had summer, which I think helped a lot of people because it took school off the table for a lot of families and allowed people to reset a little bit. But you hit the nail on the head in terms of the uncertainty. So, and I talked about this idea of fight or flight, and that's a response to trauma to some extent. But when we're threatened and then the stressor isn't taken away, we're still feeling threatened. And we're still under a constant state of stress and uncertainty. And so the stressor hasn't ended.
And of course, this time of year, we're cooped up inside again. I thought the summer was more therapeutic because you could get out and do various activities with less of a concern about spread and so forth.
Yes. And I saw a lot of protective factors over the summer, too, because it was warm enough for people to get outside. One of the things that goes hand in hand with the mental health issues that we're seeing is we're stuck inside and we might be online working virtually or doing school virtually. And if you think about when you go to work or when you go to school, there are breaks naturally designed for you, even if it's walking from this class to that class and chatting with one of your friends on the way there, or going to the lunchroom and sitting down and being able to have 30 minutes to socialize. And certainly recess and some of the physical outlets you get like that. And when we are deprived of that, it affects our mental health. And it's really hard when you're at home to build that in. And I know kids, they have school all day, and they do have breaks between classes, but I don't know how many of them are taking that time to physically get up and move around and give our bodies the stimulation it needs to combat some of the stresses that we're handling all day.
And not to mention the importance of moving and physical exercise is really important.
Yes. And so that's why I think summer was a little bit better. You saw so many people walking every day and getting outside and playing outside. And I think it was a nice reminder of how much kids need that. And I do think that was a positive. I saw a lot more outside play versus on electronics all day. So that was good. But now, we're getting to the cold months again, and it's a lot harder to get outside. And now I'm kind of seeing a rise again in some of this anxiety and depression and loneliness and social isolation. And I talk to kids all day long, and they're right to some extent. There just are not opportunities for social interaction. They're on a computer all day for class. They aren't motivated to log back on at night and chat with friends. Or if they are online, it's, just surfing the YouTube or social media and things like that, which we already know is not good in excess.
Right. I know. So are you seeing patients at your practice?
We are. We are kind of split. For a long time, we did just teletherapy. We have a couple of therapists who prefer to only do teletherapy currently, and then the rest of us kind of divide our time based on what our patients prefer.
I know that teletherapy is better than nothing, but of course, nothing beats, face to face.
I agree.
In these times, it's hard.
It is hard, and we see a lot of little kids, and that's really hard to do virtually. But we do as best we can, and we offer as much support as we can for as many families as we can. And I agree with you. I think some is better than nothing at all. And really, what we've tried to do is offer very tangible coping strategies for parents, just so they can help their children at home. So even if they're not in our office, offering tips for ways to combat some of this fatigue, and even tips on executive functioning and ways to get through the day when their kids just don't have those skills currently.
So let's get to that. Speaking of coping strategies,
Okay.
Let's move on to how we can remedy this situation. So what are some tips that you're specifically discussing with parents, with children who may be struggling?
Sure. We touched on one. It's very important that every day have some kind of physical activity. Get outside as much as you can. We really have to think about the mind-body connection and make sure that our bodies are being stimulated. Even to the extent that I'll tell kids to do school in one classroom, we'll talk about physical breaks they can do in the 5 minutes before their next class, even if it's jumping jacks, or move their computer to a different room and get the stimulation from a different environment. So making sure every day has some kind of movement is super important, and vitamin D and outside. But I also think there has to be some sort of social interaction on a daily basis, whether it be checking in with a friend or playing a game at home. And what I've really encouraged families to do, I'm a very visual person, and so if you've ever worked with me, I have suggested a visual schedule of 1 week at a time. One thing that it does is it kind of, it takes one thing, it closes one file on the desktop, if you will. So a child will know what to expect for the day, what their schedule is, but then it also allows parents the opportunity to make sure all of these important things are included into the day, including some kind of relaxation, some sort of alone time, some sort of physical activity, and something to look forward to. And this is kind of the next piece of advice. We have to be creative in what we look forward to. So especially, some families are more conservative with what they're comfortable doing, which is fine. But if you are more isolated at home, you have to come up with something to look forward to at the end of the day and on the weekend, because that's what we had before all of this. Mm-hmm. We looked forward to Friday night, going out to dinner, or Saturday going to the park. And I think there are lots of things that we can do even if we're stuck at home. It might be everyone makes pizza. On Wednesday, it's just pizza night or family game night.
Games and puzzles have really made a resurgence with all this.
Sure, they have. And kids love that stuff. I think parents forget that children are pretty easy to please if you are creative and come up with different things. And again, also that will help them get off of social media and being online all day. There really has to be that human interaction. It's just so important for our mental health.
Yeah, that whole issue with screen time is just out the window now, since that's the main way they're getting their schooling, unfortunately. Well, like I say, there might be a light at the end of this tunnel, we're hoping, with vaccines and such, but in the meantime, what other tips do you have? I like the idea of the schedule and something to look forward to, build that anticipation.
Yes. The other reason I like the visual schedule is, I guess tip number 3 is families need to focus on 1 week at a time. So we've talked a lot about there's so much uncertainty, and it really evolves slowly. It really, every week we're kind of looking for updates about what's next. And I think trying to forecast too far ahead is overwhelming, I know, to kids and teenagers, but also to adults. So if we really focus on 1 week at a time and think about each week just kind of checking in with what the status is, globally, and what we're being asked to do and told to do and what steps we need to follow, it gives us kind of a check-in point, and I think it allows a lot of people to close that file for the week. So instead of stressing about it all week long, this is what our schedule looks like this week. These are the protocols we're going to follow. Next Sunday, when we sit down and plan out next week, we can look and see if any of that has changed or, what's on the horizon. And I guess this goes into tip number 4 for our kids and teenagers. It is okay to keep them in the loop of what's happening. A lot of parents ask me, or I think try to sugarcoat it or avoid the conversation, but kids know what's going on and they want to know what to expect. And it's okay to kind of set those limits and say, each week we're going to check in and we'll tell you, what to expect for next week. You're still going to be doing virtual school this week. The Board of Ed is meeting in 2 weeks to talk about what happens next. So once we hear, I'll let you know. And all of what you're doing is closing files for them, because they have a running dialogue just like adults do of, when is this going to end? When will I go back to school? When can I see my friends? What if I don't get to play baseball this spring? So you just have to think about the emotional toll that takes when your mind is going all the time. So anytime you can answer a question, even if it's, this week is the same as last week, we'll check in again on Sunday. And, I hope, too, that things start changing with the vaccine and et cetera. Now, certainly you have to be age appropriate. Kids don't need a ton of information. They don't need the statistics on death and dying and all of those things.
Part.
But they just need to know, there are a lot of smart people at the top of our country figuring out a plan to get us all safe and out of this. And so each week we just check in and see where we are with those kind of steps.
Yeah, I like your idea of having them participate in the calendar, because we all know that the more you're involved in creating a plan, the more likely you are to cooperate with it and be excited about it. And it sounds like that's part of the plan, is getting some anticipation going and of some good things that we can do during this time.
Right. It also works for a couple other reasons. One, I think it decreases the anxiety like we talked about, because they can physically see what's going on, and it gives them a sense of control. Which right now, a lot of our anxiety is because we just don't have a lot of control over what's happening. So anytime you can give your child or teenager some control over their day, even if it's, okay, when you get done school, give me a list of 5 things you might pick from to work on, a fun project, or we're going to bake cookies or something like that. So they have choices. They get to kind of design their schedule as much as you can for the week, even down to like what homework you're going to work on and when you're going to do that, how that looks. And you're right, it helps with buy-in, and it keeps them motivated to follow through on what they've chosen to do.
And what are your thoughts on pods? Some places have allowed kids, if they're people they see all the time, to be together and allow them to socialize, outside preferably, but is that helpful? Or
I think as long as people are following, the guidelines that they're telling us. And what I tell everyone is we can't completely prevent all risk. We just do the best we can to minimize risk. And I think what people are comfortable with varies, and I think that's okay too. I don't know what tip we're on, but I guess the next one would be, I know that there's a lot of anxiety caused by navigating interactions with people who have different levels of being comfortable with what they're comfortable with. And this really applies for a lot of kids too, where you might have a child who is very anxious about COVID-19 and attends one of these pods, or maybe goes to school, and because some of the private schools are still running, and gets there and other kids just aren't taking it seriously, and that causes a lot of anxiety. And so I guess the tip is giving kids and teenagers the words of how to express that to people around them. Or if a friend invites them over and they're not allowed to go because their family isn't doing play dates. helping children communicate that to their friends, because there's a lot of anxiety of, I don't want my friends to be mad at me. I don't want them to think I don't want to hang out with them. But kids don't actually have the words to express that appropriately. And even some adults probably.
Well, I was going to say there's a fine line, and it applies to grown-ups too, about, socializing a little, just to have some mental health benefits versus total isolation.
Yep.
It's a tricky situation. I know if you can just mention maybe a few general tips you have. You talked about tips for children and parents and so forth. What about generally speaking? What can we recommend for people to optimize their mental health during this time?
Sure. One that I didn't touch on has to do with validation, but also just a little bit of acceptance. So I think people feel very bad when they get stuck thinking in like all or none terms. Like, this is terrible, this is never going to end, I've missed out on X, Y, and Z, my kids missed out on this. And I think people do better when they're able to say, this has been really hard, and we are getting through. There has to be an and. We have to acknowledge, it's okay to acknowledge all of the tough times, and that they are happening at the same time as positive things as well. So I really hate being stuck at home, and I've enjoyed extra time walking with my kids. It's okay to have both. Right. It's okay to be sad. It is okay to be frustrated and angry. And also have positive feelings at the same time. And I think acknowledging that as an adult is important, and then also being able to validate and, I guess, model that for our children and teenagers as well. I'm so sorry that you didn't get to play baseball last year. That is terrible. And not being quick to swoop in and say, but it's just baseball. You don't want to invalidate.
I know people that miss their commencement, in-person graduation.
There's so many examples.
Yeah.
And I think parents feel so bad and want to swoop their kids up and make it all better. But I think it is okay that we can't. As long as we can model for kids that sometimes bad things happen and we are okay. We have to focus on things that have been okay, still be positive about the future. So in terms of validating, it's just really important to be able to validate the feelings. It's okay to say, I feel the same way. I'm so frustrated that we're not going to see our grandparents for the holidays. That's a big stressor happening right now. And I really look forward to when this is over and we get together again.
Yeah, that's another population that's really taken a hit, is the isolation of our older adults and so forth.
Yes.
I know one thing we can probably say is when this is over, I think everyone should have a greater appreciation for what normal life was like. And of course, they say we may not ever be back to totally normal, just near normal, and to me that would be a big improvement over what's going on right now. But and of course I know you wanted to talk about the importance of getting outside, exercise, eating right, taking the time to enjoy family time, which I think we probably ignored that a little bit prior to COVID. So.
We did. And so like I said, this has been really tough, and it's also been eye-opening for a lot of people. And, I hear parents say I had no, now that I'm doing school all day with my child, I really have a better understanding of how they learn and what supports they need. So, I think it's been good information for a lot of families. And I agree with you. When we come out of this, I think it might change behaviors for a lot of people and how they go about life in general. It really has slowed us down in a lot of ways. Which I think people needed.
Enjoying the simple things. Baking bread. Who would have thought?
I know.
Well, Samantha, thank you so much for being on the program. I'm so happy you could come in today and share your expertise with us on this very important topic.
Yes, thanks so much for having me and helping to share this message, because it's so important.
And thank you for joining us for this edition of Focus on Health here on PAC 14.